There's a variety of different treatment options. As we know that really the only treatment options for glaucoma are pressure mediated. So there's not anything that we can take by mouth that is going to help to regenerate nerves, or there's not anything at this juncture that's going to regenerate tissue or be what we call neuroprotective. People are studying that, looking into that, but at this point we don't have anything that we can use with that regard. So really all we have is something that can lower eye pressure, treatments that can lower eye pressure. And so we generally, in most cases, we will start with actually a laser treatment. It used to be in the past that we would start with an eye drop, and then we would then lead into laser. There's been a wide number of studies that have been done recently that have looked at whether or not laser first or drop first is better therapy, and laser first actually is the better therapy. And so generally in most cases we will start with a laser that's called an SLT laser. It's a pretty simple laser. It's done in the office. It takes a couple of minutes and then you go home. So it's not that different than just getting your eyes examined. What that does is it treats the filter of your eye to try and open up your natural filter so that your fluid can go out through your natural drain. And so that generally is disease modifying to some degree. And so that is in part why we feel like it's actually better than taking an eye drop. If that doesn't work or it's not sufficient, then generally, yeah, we will move on to eye drops. In addition to that, there's recently been a couple of options where there are medications that can be implanted, kind of sustained releases medications that can be implanted in the eye and help to basically deliver the same medication, but a little bit more targeted, a little bit more specific without having some of the side effects on the surface of the eye. And so that's another group of treatments. And then beyond that, it's moving into surgical options. And so the surgical options are either trying to open up your natural drainage channels. We call those minimally invasive surgeries, typically, is opening up some of those canals and drainage with little tiny stents. And then beyond that, it's usually moving on into other surgical devices that drain the fluid out of your eye into an external space.